So another thing that I wanted to discuss that's very common and pretty much see it all the time and can sometimes be tricky to treat is tennis elbow. The actual medical term that we use is lateral epicondylitis. This is pain on the outside of the elbow. And it's one of those things that does get to surgery from time to time, but there are many things that we do before that to treat this. Now, some of those things can be a little bit controversial in terms of whether it really helps or not. Also, from a patient standpoint and also from a physician standpoint, it's one of those problems that really I find it's very common because it's basically a tendonitis of the elbow from overuse. Essentially, that's what I see. I don't really necessarily see it related to tennis, but that's kind of the name that it gets, and that's what people understand as this tennis elbow. Usually I see it in people who are, working very hard and it's hard for them to kind of stop doing what they're doing. I mean, it's their job, their activity level is high. So the thing about it is that there's no real quick fix necessarily. Sometimes we can hit a home run easily with injection, counterforce brace, which is tennis elbow brace. You can get those over the counter and whatnot, anti-inflammatories, actual steroid by mouth and things like that. So sometimes it is possible to do one of these interventions and it just fixes it. And so it does happen. But as a patient, your expectation, you have to expect that when you have that diagnosis, that it's going to take a little time. One of the controversies I have with patients is that I always tell patients that I consider the treatment to be proper occupational therapy. Now, what does that mean? Obviously, it's not about range of motion or strength necessarily. A lot of people who have this are already active. Their joints and everything work fine, and it's not necessarily a functional thing. What you're trying to do is get the body to heal on its own. So the different modalities or treatments that the therapist has, in addition to certain exercises to stimulate the body to heal. And I find that the combination of doing those exercises and the topical treatments that the therapist has, given enough time, and I would say out of all these components, time is probably at the top of the list. Given enough time, we can get it fixed. Now, the issue is that most of the time, people do not want to give it that much time. They have to get back to their activities. This is slowing them down. This is making simple things like picking up a gallon of milk hard, and they can't understand. And so the difficulty is getting agreement and buy-in that therapy is the thing to do. So one of the things we do steroid injections from time to time in the elbow for the tennis elbow. This is actually more controversial in the medical literature. It's not controversial for patients. Patients come and expect and want a injection. They expect that it's going to fix their issue and they're going to get on their way. The medical literature says otherwise. It says there's a big question mark on whether or not steroid really does anything. So, there's kind of a crossroads here where, I do give injections for this a lot of times because it can give some temporary relief. It can buy a little time to allow something like therapy to work. But ultimately, my philosophy is to treat this with proper occupational therapy, bracing, and activity modification, meaning trying to get some rest from whatever you're doing. So keep that in mind, that the biggest thing that you should understand is that there's not usually a quick fix. Sometimes you get lucky. Sometimes the injection does fix it by whatever anti-inflammatory mechanism. But the problem is that you have these micro tears in the tendon that just don't heal. And that lack of healing presents pain in that area. So let's say that we've maxed out all the non-operative things. The one thing I would say is that in general, I don't go to surgery unless you've had a minimum of 3 months of therapy, but that's even kind of close. I mean, I would say 3 to 6 months. I mean, I think if you've had, because there's a time factor built into this. So if you've had after 3 to 6 months of therapy, maybe we've done an injection in there somewhere, you had to brace, you've modified your activities, and now we're going to surgery. And so one of the things you can do as an exercise is you can look up on Google how many procedures are there to treat tennis elbow. And you'll find that there's a pretty long list of things that can be done to treat tennis elbow. There's percutaneous releases, there's ultrasound guided percutaneous releases, the 10X procedure, there's epicondylectomies, there's standard open debridement or cleaning the tendon up. There's a long list of things. Whenever you see a long list of potential surgeries that can be done, usually that means that none of them work 100% of the time. And so I would say that that's the case. I would say for the vast majority of people that get to surgery, so we've tried all those other things, we've done therapy, the vast majority of the people that get to the point of surgery, whether we do it open or percutaneous or however we do it, most do get better. But there's a subset, maybe it's 5%, maybe it's 10%, but it's just a decent number that still requires a significant amount of therapy afterwards. So even then, even after getting through everything and then going to surgery, you still had the potential of having to deal with residual symptoms afterwards. So I think that the take-home message is that no matter which way we go with tennis elbow, whether it be the non-operative type things, the percutaneous and the newer ultrasound-guided percutaneous type situations, even PRP, you name it. I mean, there's so many things. There's for tennis elbow procedure-wise, but there's so many things because there's not one that's just 100%. It's one of those problems that from a patient perspective, it's kind of nagging. And from a physician perspective, it can be kind of nagging too, because you can kind of do several things and it just doesn't get better. So just realize it's one of those things. Hopefully when you come in and we treat it, whether it be non-operatively or operatively, hopefully we hit the home run. And I would say for the most part, we get good results with tennis elbow, but it's just one of those problems. It's so common that I thought I wanted to mention it because it's one of those things that, and a lot of people have different concepts of how it's treated, but I want to make sure that the biggest thing, that my treatment relies on time, proper therapy, activity modification, anything that can get the body to heal up on its own.